I'm Ramon Luengo-Fernandez. I work in the University of Oxford.
Okay, can I start by asking you, do you think that it's an important time to be having this debate on the costs of dementia?
Yeah, it is quite important, especially because the government are now saying that dementia will be prioritised by the research funding bodies. So I suppose there has to be a clear rationale to why the government is putting an emphasis to dementia, not an emphasis in other diseases. And one of the arguments is that dementia is a high burden disease, so it's worth for society to invest money on it.
What do you think the key issues should be that we should be discussing right now in relation to dementia?
Well, no, it's very severely underfunded compared to other diseases such as cancer or heart disease. So one thing is to start looking at basic studies to get to know a bit more about the disease.
Yes. Why do you think it is under-researched or under-invested in compared to other diseases and illnesses?
Partly it must be, there's not only government that funds research, it's other charities. So big charities say like Cancer Research UK are very big. People know they're out there, so they're more likely maybe to give to that. Also maybe dementia is for older people, so maybe they haven't cried too much for funding, so it's kind of a forgotten population.
Sure. Oh, carry on.
And then also in terms of research, maybe the government or funding bodies have thought that dementia is not, you can't get as much out of the pound they give, like cancer, where a pound might find new treatments quite quickly, whereas for dementia, there might be a perceived thing that it's still, there's nothing we can do about it, so let's not invest money in it.
What would you like to see raised and discussed this afternoon at this event?
Reasons why dementia is underfunded, and maybe kind of destroy some of the myths surrounding it, and also kind of get dementia out there, that it's an under-researched area and that it's a high burden to society, not only in terms of the economy but to patients and their families.